A man walks towards a locally made condom dispenser box, quickly picks condoms, and hurries away from the scene. This initiative of placing condom dispensing boxes in strategic areas for the whole community to access free of charge is by joint efforts for Youth Uganda, a local community-based organization. The organization used the Lot Quality Assurance Survey data, or LQAS data, from Piju district to initiate this HIV prevention activity.
We went to the district through the DHO office and the HIV focal person. We received the data, the LQAS data for the previous years. It was 2012, 2013. We used it and refined our proposal. The problem statement was very good, and it enabled us to get funding.
To plan effectively, individuals, organizations and authorities need to have enough information. In Uganda, local governments have had a challenge of having reliable data in order to make informed decisions.
Initially, we have not been having a quick and accurate data which we can use for planning. You know, it's like we would take a long time to get the data which is good, because when we talk about surveys, these are like behavior surveys which take about five years to come.
In response to this challenge, districts have been supported by the USAID-funded project Strengthening TB and HIV/AIDS Response in Eastern Uganda, STAR-E, managed by Management Sciences for Health, with technical support from Liverpool Associates in Tropical Health to carry out the Lot Quality Assurance Sampling Survey. The surveys have been held annually for the last 6 years.
Lqas is Lot Quality Assurance Sampling methodology. It is a simplified methodology that facilitates getting performance data about performance that helps to guide planning and actions for service improvements.
STAR-E, together with other USAID-funded partners, is promoting the use of LQAS methodology to empower districts with data for decision-making.
It has opened our eyes because the data that is generated is based on service delivery trends on the ground. Before this survey, we were more or less gambling, but now all our interventions are based on the basis of factual data.
Districts have been supported to carry out community surveys to gather data, which is then disseminated to both technical and political leaders of the districts and other stakeholders like NGOs and CBOs to inform their planning, budgeting and policy formulation.
STAR-E has been involved much in supporting the district, in providing questionnaires, technical guidance in areas of LQS, overseeing the processes involved in the LQS application.
Since we started collecting the LQS data, so far we have been using it to assess our performance, leave alone the HMIS, but we have been comparing the two. Because LQS goes down to the community, but when you look at HMIS, it's data captured at the facility. So we use mainly LQS to give us the community picture.
LQAS data has been very useful in planning for HIV/AIDS and other health interventions in the districts.
The Lqas generates red flag areas, need areas where we are performing so poorly, at times even below national average. So we take those as focal gaps. We had a sub-county called Chibiga. We have a sub-county called Chibiga. It is 4 kilometers away from here. And that sub-county had the highest HIV/AIDS prevalence. People did not even know modes of transmission of the disease. So last year, taking from the Lqas findings and data, we had to take World AIDS Day celebrations for the district in that sub-county, just to upscale information and knowledge about HIV/AIDS management.
We had the challenges of transmission of HIV from mother to child, where it was high in some areas. So we had to come in and made interventions through even other partners like the Comic Relief, who came in and helped us in Kameke Health Center, where they came and we had to make sure that the attendance of mother, that natal attendance, where it had reduced, it had to increase because of the innovation they came in of the border ambulance. It came out of the report we had given basing on the finding of the Lqas.
There was an area in Galilaya where there were no condoms in that particular area. So on that, after that information reaching us, we mobilized an intervention to make sure that condoms don't only reach there, but we make plans to sustain the availability of condoms on those landing sites.
Kitgum district used data from Lqas, which had red-flagged the sub-counties of Mochumi, Orom and Akwang as performing poorly in maternal and child health indicators. They established outreaches to those areas with support from Rotary Club of Kitgum.
We realized that the district has little capacity in going to hard-to-reach areas. So we wanted to find out whether we can help the district to reach these hard-to-reach areas. So we went to the DHO and he gave us some data of areas where they feel their capacity may not enable them to reach those areas. And when they gave us, then we made a small questionnaire and went out to carry out a community needs assessment.
High prevalence of waterborne diseases in Padel district clearly indicated in the data collected that the sub-counties bordering South Sudan did not have enough boreholes. The district mobilized resources to dig more boreholes in the affected sub-counties.
These sub-counties were, for last financial year, were Lapul sub-county and Angagura, which they had very low sanitation coverage, up to a tune of 31 and 41 respectively. But at the end of the year, we had an increment of 60% in Lapul and 81% in Angagura of sanitation coverage respectively.
Institutions and organizations providing care and support to orphans and vulnerable children provided useful data through the surveys conducted. As a result, districts have been able to come up with comprehensive orphan and vulnerable children strategic plans.
In the OBC area, we have so many people providing services, or CSOs providing services to OBC and OBC households. So we want to know or to measure, for example, how many households are getting external support vis-a-vis what the CSOs are reporting to us. So when we put together all this critical information, it helps us in planning as a district to integrate it in our development plan, the 5-year strategic plan.
We have used the data on LDP, Leadership Development Program. I happen to be one of the members who attended these sessions of LDP, Leadership Development. But at the end of it all, we are required to write our strategic OVC plan, to review the strategic plan. And we used the Lqas survey findings in coming up with the revised strategic plan.
There is community dialogue and on the nutrition screening in supervision areas which are burdened of where there is issue of nutrition as a big gap. We have flagged areas in nutrition, as you have seen. So there is screening going on. We have Family Health Days program, which goes to places of worship to make sure that we screen all minors children, all children under 5 years, and pregnant women.
Star E also facilitated districts to carry out the health facility quality of care assessment. The assessment is based on a tool that reflects the Ministry of Health standards and those set by the World Health Organization. Assessment of health facilities has helped district health teams and health facilities staff to track progress in improvement of areas of service delivery where data has revealed some shortcomings.
First of all, it's a Ministry of Health-led program. What we are saying now, we have to institutionalize it right from the start. Ministry of Health-led, train district supervisors so that they own the process. They are the ones, not other people coming in to do the supervision, but themselves. And secondly, build it in within the already existing supervision mechanism, not a standalone thing. So we are saying instead of planning or conducting because support supervision is done every quarter, and there's funds for that within the PHC. They may not be adequate, but at least it is an institutional framework. And so, instead of conducting the routine support supervision visits during the third quarter, they'll do the what? The assessment.
They pointed out to me that we've not been capturing the previous, what we discussed, the way forward in the previous minutes, in the meeting that we were to hold at that moment. And also, the Health Unit Management Committee guidelines, we don't have it. I need to follow it up. A database file for staff on training. I need a file so that every staff who goes out for a training, I jot.
I realized that there are a number of things that we as a district need to address. From this tool, I have discovered that there are gaps that the district should come up with solutions on as well. And I feel this tool is quite a wonderful one. If we can only use this tool to always monitor the progress of our service at facilities, we are likely to improve.
Districts have appreciated the importance of LQAS, and some, like Kitgum in northern Uganda, have managed to incorporate LQAS in the district strategic plans and will be conducting their own surveys in 2015.
This LQAS, operational research itself, we have already integrated in our district development plan. So, certain partner give us money. But fine, if you give us, we say give it to the district, and we implement within our district strategic plan. And we have already relocated resources for that. Actually, as I talk, this by the end of this year, or early next year, we are going to conduct an LQS.
We think since we have the primary responsibility to provide the services, we shall also have the responsibility to sustain all the activities within our budgets and plans, our local resources available to the district council, both central and local government resources, so that this LQS becomes something that is routine as part of our routine monitoring and evaluation.
As the project winds up in 2015, districts are grappling with the challenges of sustainability. While STAR-E has built the capacity of districts in terms of human resource, the question of finances to facilitate the surveys still poses a challenge.
We have the issue of funding. We have the issue of staff turnover. Those ones who have been trained can leave, they leave and get other jobs, and they go to work elsewhere. Then we need to train others. Then we have a problem of course, moving to those countrysides. Communication problems. The department, you can see, is we don't have transport, we don't have motorcycles, not even just a bicycle. It is very difficult to get to the people deep inside there to collect the information.
The Ministry of Local Government and other ministries like that of Health, Gender, Labour and Social Development have shown commitment in allocating resources to ensure that LQAS is institutionalized in the operation of districts to facilitate identification of service delivery gaps and how to address them, as well as ensuring continuous monitoring of areas requiring improvement.
The ministry will carry out field visits to not only to ascertain how we have managed and applied LQAS, but also to lay strategies during financial year 2015-16 for its sustainability and rollover to other local governments.